Hi, good afternoon everyone. This is Yu Hsuan from Montfort Care. This is my pleasure to share with you about our caregiver support programs. The main purpose is to enhance the caregiving experience. Before I start to share, allow me to introduce what is Montfort Care about. Montfort Care is a network of programs committed to improving the life of the individuals, families, and the community facing the transitional challenges. We are a group of social workers. In response to the aging population, we now also have a registered nurses and health carers. We are committed to delivering community-based social service to empower life and strengthening communities. Montfort Care is a network of programs committed to improving the life of individuals, families, and community facing transitional challenges. We are a group of social workers. In response to aging population, now we also have nurses, health carers to support the seniors. We are committed to delivering community-based social service to improve life and strengthening communities. We have our three very unique care values: dare to be different, chongness, and teamwork. Dare to be different, we are willing to challenge the norm and to inspire others through our actions. We are very chong. We try our best to overcome limitation and to drive to make things happen. We teamwork. We are not just teamwork within our organization, we are also teamwork with others, other community partners. This is the motto we breathe in and breathe out every day. Those whom the world rejects must move you the most. This motivates us every day to serve our seniors in the community. We also have several centers in Singapore. We have three categories: Family Service Center, Elder Care Center, and Specialized Center. The three FSC, which are at 27 FSC in Teluk Blangah, Greater Ayer FSC in Chinatown, Marine Parade FSC in Marine Parade. We have Elder Care Center, we call it Good Life Center. Good Life at Budok, Chua Payoh, Greater Ayer, Yishun, Teluk Blangah, and Marine Parade. Our three specialized center: Big Love, Child Protection Specialist Center. Our Grief Matters to serve the bereaved person. Ya, our flagship program to serve active agers. This is our Good Life approach. We hope to enable all the seniors in the community. For the active ager, they will have a positive attitudes towards their active aging lifestyle. We hope they can age well. However, inevitably, seniors will decline and they will become frail. When they face frailty, we hope they will be able to well care for and supported. When they are facing end-of-life issue, we also hope they could live well through our programs and our intervention. This is our approach for our caregivers and older person. Our approach is selective optimization with compensation. This is all about inclusiveness. We work with our caregivers and older person together as a team. They are our team member and a social worker. We are just a facilitator to help to complete whatever they wish to have. We work with them to adopt co-creation process in our programs and outings. Empowering our caregivers and older person with decision making. As I said just now, as a social worker, we don't really intervene in their decision-making process. Our caregiver and older person, they make decisions themselves. We improve their health and well-being. We emphasize about what they have, but not what they lost. We educate and spread awareness to public and community. There are two initiatives I would like to share with you how we implement inclusiveness in our program. Community Caregiver Lab. In the last 2 years, we worked with 50 seniors and caregivers to come out different ideas and to test back in our community. We use design thinking framework to emphasize, to define, to idea, to prototype and test. We prototype 3 different interesting ideas in our community. Those ideas are actually generated from our caregivers, not the social workers. A lot of caregivers share with us Actually, they hope to have a hotline they can call in when they need a listening ear. And we were thinking, hey, actually now a lot of hotline available already. However, since this is the idea, we just try. Our caregiver hotline act as a listening ear. We do needs assessment. We also provide service navigation, coordination, and linkage. Now you see it's very first draft our flyers talk about our hotlines. However, when our first flyer distribute out to the community, actually no one respond. We were thinking what's happened. So we asked our caregiver, can you give us more feedback about our flyers? This is our Chinese version as well. So a lot of caregiver feedback, hey, actually your wording are very confusing. You should change accordingly. So this is what we changed based on caregivers' feedback. They were also thinking, hey, your design should be more related to the Telok residents, which this project is actually mainly in Radin Mas. So they said, why not you use Henderson Wave photo? Then we change accordingly. Surprisingly, when we send out this revised design flyer to our residents, we receive more feedback from our residents, and we receive more calls. The other thing I would like to emphasize is the Chinese version. A lot of time we talk about caregiver in Chinese, we talk about 看护者. However, our Chinese-speaking caregiver, they share with us, hey, actually we are not a 看护者, we are the 观护者. 看护, they mean professional doctor, professional nurses, and professional caregiver. They are not a professional caregiver, they are the family caregiver. So they would like us to change the Chinese word to 观护者. When we change to 观护者, surprisingly, there are more people call also. So as a social worker, we learn to listen to our caregiver and accommodate their feedback into our program. This is another ideas caregiver come up. They hope to have a physical map to understand more about the community resources in the community. This is the English version. So they share with us what to put in this map. Yeah, you should put in more self-care tips lah. You should put in more health nurse hotline, whatever. So we put in according to their feedback. This is the Chinese version. So our team member, which our caregiver, our 50 caregivers, share with us what kind of map they want to have, what kind of legend they want to put in, how big the phone size they would like to have, how many agency they would like to work with. They would like to see they have a clinic, they would like to see formal agency, they would like to see CC in a map. So we, based on the caregivers' feedback, we made this map together with caregivers. The other interesting ideas our caregiver come out is family care journey. A lot of caregiver feedback when a loved one diagnosed at the hospital. Many healthcare professionals focus a lot on patients, but not the caregivers. Caregivers themselves also realize, hey, actually I'm quite okay. I learned enough knowledge, I learned enough skills to take care of my loved one. However, when the patient go home, right, then they start to realize, actually, a lot of things I can't do. I don't have enough knowledge, I don't have enough skills. So caregiver actually told us, right, we should work with the hospital more to have an on-site diagnosis service to all the caregivers, to provide timely support to our caregivers after their loved one got diagnosis, create new linkage between the caregiver, the community, and healthcare. This project, we are working very closely with SGH. We hope we can share more when this pilot phase is ended. This is the second initiative I would like to share with you about Dementia with Dignity. We use a lot of ideas and philosophy of inclusiveness to include caregiver and a person with dementia. This is the adventure. Many caregivers who are taking care of a person with dementia share with us. They actually wanted to bring the dementia person out, but because they're scared, they cannot find a proper toilet, they're scared they cannot find elderly-friendly places to bring their loved one. So we hear their voices, we work with the caregivers, so the caregiver, they have a committee they list down whatever places they like to go. So when they list down the places, our staff will do a recce. If the white path enough, if the toilet is dementia friendly, elderly friendly enough. When we confirm the place, we bring the group of elderly, person with dementia, and a caregiver to visit the place and to have a fun together. However, caregivers are not just the recipient end. They also do a lot of preparation during this trip. Some of them, they are the finance, they collect the money. When they need to eat right, they will spend the money together. Some of the caregivers, they are the planner. Some of the caregivers, they are the photographer. This trip made them feel, hey, I'm still very useful. I'm not just a caregiver to one person. I can also be a contributor to my caregiver peers and many of the elderly. This is another example. We hope to use our inclusiveness to make impact in our society. This is one of the restaurants in Jewel. Actually, we bring a person with dementia to Jewel to visit. In our very first visit, this restaurant, actually they didn't arrange a proper table for a person with dementia. So the first dining experience was not very good. So then we feedback to the manager, actually a group of seniors, they require more space, and your staff doesn't need to help a lot, but our caregiver will come in. So in the second visit, the manager actually arranged a wider path for the wheelchair and arranged a bigger table for our group. Actually, this is also our mission, to influence different society, influence different people in this community to embrace, to accept different type of older person and different type of caregiver. We also do a lot of public education for the community support. We also involve in the town audit with the different community partners to see where is the environment need to be changed. For example, person with dementia, they will require more visual cue to bring them home. So with the visual cue, we'll be able to see, hey, actually person with dementia, they have a lot of things to do in the community. Follow the visual cue, they won't get lost too easily. So this is the work we have done with the community partners. This is the Kopitiam we are currently rolling out to the public and to support the person with dementia and a caregiver. If you are interested, you can scan the QR code and do a registration. We also have a support group for Malay residents. If you are interested, you can also call this number. Our programs are currently FOC, so feel free to join us and enjoy our program to support the caregivers. Before I end my presentation, I would like to share these photos with you. So last year we have a photo competition to engage caregivers who are taking care of a person with dementia. So this is a winner of an open group. This caregiver, Enqi, she is the 17-year-old lady. Her great-grandmother is a person with dementia. The whole family is very supportive and would like to provide the best care for the great-grandmother. However, the whole family keep thinking, right, how can we draw back our great-grandmother's memory to enable her to remember us? However, after reviewing so many photos, this Enqi, the great-grandmother's photo, right, she keep asking herself, is this how important is memory, which all people will lose slowly with time? When we begin to realize it is the emotion, the timeless joy that truly sticks with people with dementia, a sense of hope emerges. This photo, it seems confusing, unappealing, but who is to judge the emotion and the happiness and ingenuity of the person with dementia? If you have any question about my presentation and our programs, please feel free to contact me through email or text me. Later, we also have a Q&A session. Feel free to post your questions. I'll be very happy to attend to you. Thank you.